EndoSequence is the first endodontic system to be fully synchronized from instrumentation through obturation and post-placement. The following tutorial will review the EndoSequence post-placement technique. You can think of the EndoSequence post like a prefabricated cast post because you don't need to alter the shape created by the last rotary file used to shape the canal. Unlike other systems, there is no need for a post drill to create the post space. This eliminates the fear of perfing the canal and reduces the likelihood of root fracture because there is no undue stress placed on the root. The post space is created using a powered heat source such as the Endo Pro 270 by Brasseler USA. The Endo Pro 270 should be used at 270 degrees Celsius and taken to the desired length. You should then let the tip cool for at least 7 seconds and apply a blast of heat while wiggling the tip out of the canal. The following video explains an alternate technique for making post space, but either technique is effective and the technique used is the clinician's preference. The EndoSequence post comes loaded in an autoclavable block, which serves as an ideal tray setup. The posts are highly radiopaque and are factory silinated. They have a low modulus of elasticity, closely matching that of natural dentin. The appropriate EndoSequence post is chosen by referencing the post selection guidelines which are included in the kit. Or if you know that you want to place a post prior to obturation, you can simply test fit the posts until they reach taper lock in the canal. You can determine the apical plug of gutta percha needed based on the distance between the working length of the canal and the length that the post protrudes into the canal. For instance, most of the time you will need a 5 to 7 millimeter gutta percha plug at the apex. With this technique, you can obtain an apical plug of gutta percha by simply sectioning the apical portion of gutta percha and plugging it down to the apex. Here we are showing a novel technique where the practitioner scores the gutta percha at the appropriate length with a sharp scalpel. This sectioned piece of gutta percha is still intact, so later when we insert it into the canal, we will be able to section it from the master cone, thereby making the process simpler. This is our EndoSequence BC sealer. You will coat the cone and the canal just like you normally would. In this instance, we're taking a small EndoSequence file and we're going to coat the canal walls with this, which basically eliminates the chances of getting blocked out of the canal due to hydraulic pressure. You could also use a small hand file or a gutta percha cone to apply a thin coating to the canal walls. Next, we will coat the cone with the sealer and slowly insert that to the apex. The cone is then twisted and the apical portion of the cone remains seated at the apex and the coronal portion is removed, thereby creating your post space. The dentinal walls above the gutta percha then need to be cleaned of debris to allow for proper bonding. The diamond provided in the kit is ideal for this application, or a small ultrasonic tip can be used as well. The important thing to remember is that we're not trying to change the shape of the canal, we're merely cleaning the walls for proper bonding. The post can be trimmed chairside with a diamond disc if needed. Always trim the post from the wide end, which has the color code. Next, you would simply place your current bonding agent and then you would apply EndoSequence core buildup material, and we include small tips which help to place that dual-purpose core buildup post cement into the canal. You can then immediately build up the core and finalize your restoration. Through endodontic synchronization, the EndoSequence system allows you to take a minimally invasive approach to your root canal therapy and post-placement procedures, thereby maximizing the long-term prognosis of the tooth.